Welcome to our number dose of the Home Show on News Radio WRVA. My name is Richard McAnn, your home improvement guru. Good morning, Peg, and happy birthday to my bride. This coming Wednesday is her day. All right, we have on the line Dr. Ben Hopsicker. How are you, sir?
I am wonderful. How are you this morning, Richard?
I am doing what I do every single day. I am living with chronic pain.
Bummer.
Yeah, you know what? You, my dear sir, of Chronic Care of Richmond, are somebody that I have been meaning to get in touch with, and you're a sponsor of the Home Show next week, correct?
Yeah, we're super excited to be able to be there and be a part of it.
Good. I have lots of questions. I have lots of questions now. Let's start with you, though. Where did you get your start, and how'd you end up here?
I got my start. I've been a chiropractor practicing for about 17 years. I was practicing in Northern Virginia. I came to Richmond specifically to join the practice, Chronic Care of Richmond. We are an integrated practice, and the nature of the services that we're able to offer really are significantly better than what I was able to do on my own in Northern Virginia as it relates to helping patients who have chronic pain really get back a lot of quality of life.
Now, I visited my very first chiropractor in 1992, right on the corner of 23rd Street and 3rd Avenue. I walked in and I crawled out and never said I would do it again. Then I started going about 20 years ago. You guys are varied and different when it comes to your styles.
Absolutely. Yeah, the approach as it relates to the process of helping somebody get back to mobility and get back to their function can vary quite a bit. We really pride ourselves as a practice on being very much patient first and focusing on understanding what their specific needs are, what's going to be the best course of action to help them get moving in the right direction, and providing the services that are going to give them the best long-term results.
Now, I know, Ben, I've been told that you listen to my show religiously every single week for the last 23 years. So let's address something, kind of an elephant in the room. There are some people out there that don't think chiropractic is medicine. Can you really just debunk that for them? Because I know better.
Yeah, absolutely. You know, the argument against chiropractic as medicine tracks to a degree for a lot of folks who are looking for a pill-first approach, right? We don't prescribe pharmaceuticals as a profession, and that has been one of the largest obstacles to our getting involved in what's considered modern Western medicine. The reality is actually our work is getting closer and closer with Western medicine. We still don't prescribe, but we work very closely with orthopedists. We work very closely with physical therapists. Really great practices are going to take a coordinated approach to your health care, and our objective with chiropractic and with rehabilitative medicine is to help you get back to moving in a way that is not adding fuel to your chronic pain.
I want you to picture this. Can I just call you Ben or Dr. Ben?
Sure. Yeah, go ahead.
All right, Dr. Ben, I want you to picture this. Picture a 32-year-old. I walked into a chiropractor's office. My shoulders were bent forward. I could not raise my head. And my right foot, I couldn't put it down. It was just sitting on my toe. Ever seen anything quite that bad before you cracked them open?
I have seen patients who come into my office like that. I don't know that I would adjust on a first day with that degree of severity. I would definitely want to do a very comprehensive examination, and depending on the results of that finding, we may need to order some advanced imaging. But given that type of a history, that's definitely a sign of some pretty significant neurologic damage, and you would need a thorough assessment.
So I've been hearing about Chronic Care of Richmond for years and years now, and I say your name about 20 times. Tell me the difference between me just going to a chiropractor, which I've done a million times, and coming to see Chronic Care of Richmond.
So as I mentioned in the beginning, we are an integrated practice. So it's not just chiropractic services on offer. We also have availability for regenerative medicine, and we have an entire weight loss practice associated with what we do. Our primary objective is not necessarily just to help you control your symptoms. Certainly, we don't want patients who are coming into our office to be in repetitive pain, and I want you to feel better as a result of the work that I do. But our primary objective is to take a comprehensive approach to managing the cause of your pain, whether that problem is associated with bad nutrition habits, whether that problem is associated with some type of a repetitive motion injury, whether that problem is associated with bad lifestyle habits, whatever the issue is that's leading and adding fuel to the chronic fire that's creating your pain and your dysfunction, we want to have an approach that's going to help you to shut off the source of the damage and then develop strategies to repair as much as your body is capable of doing on its own without drugs and surgery.
Now, we have the Chronic Care of Richmond text line right here, and Wayne wrote in, my question to the doctor is, will he do the RPR therapy without the stem cells? Stem cell treatment is very costly. Insurance will not help with it. What is regenerative medicine? Because I've heard that term a million times, but it might as well be a buzzword for me because I don't know what it is past regenerative and medicine.
That's fair. A lot of people really don't, and that's part of the reason I'm happy to talk to you. So when we talk about regenerative medicine, really we're talking about two different services. One involves the usage of stem cells, and the other is going to involve PRP, platelet-rich plasma therapy. The question from the listener about PRP therapy, yes, depending on my patient's need, PRP can be made available for the specific needs of the patient, assuming that it's going to be able to provide them with value. We're not in the business of pounding square pegs into round holes. So we're going to understand everything that's happening before we make a recommendation.
Wait a minute,
As it relates to what is regenerative medicine, go ahead.
Well, no, you said platelet replacement therapy. I donate platelets. Are you taking my own platelets? Or are you taking someone else's platelets? I'm a little confused on that one.
Yes, platelet-rich plasma is not a platelet replacement therapy. We do draw one vial of blood from a patient that's a candidate. It gets spun out in a centrifuge, and then you actually draw out the platelet-rich layer. Platelets are essentially the repair cells of our red blood cells. Our body is using them to help rebuild damaged tissues all over our body. It's also very useful to help promote the rebuilding of blood vessels. It's going to help get oxygen, nutrition, and appropriate chemistries to chronically damaged tissue to allow it to more effectively repair itself in the long run.
Ooh, I'm liking where this is going. I think you and I should be friends.
Sounds good to me. Let's go.
All right, Doc, I'm running out of time in this segment, and Brian will throw things at me if I go over. So can you hang out? Do you have plenty of time? Do you have some extra time this morning? Or do you have to run off to get a donut?
I don't do donuts, man. That's not going to help you to heal. Yeah, I'm available.
All right, so what we're going to do is we are going to take a break. I want to talk to Dr. Ben. If you have any questions for him, send it to the Chronic Care of Richmond text line, 833-804-1140. Doc, here's a couple of buzzwords I got for you. Ready? Degenerative disc disease, rheumatoid arthritis. Those are the things we're going to talk about when we get back. We cool?
Yeah, sounds great.
Outstanding. My name is Richard McAnn, and this is the Home Show on News Radio WRVA. Richard McAnn on News Radio WRVA. 833-804-1140 is the phone number, or give us a message on the Chronic Care of Richmond text line, 833-804-1140. Dr. Ben Hopsicker, are you still with me, sir?
I am still here.
I am so glad. You're from Chronic Care of Richmond, and we're talking, well, right now we're talking pain. If you did not know this about me, I come from a construction background. I am 52 years old. I started doing stuff that I really shouldn't have done when I was 10. So most of the guys I know, we're all hearing the same thing. Knees shot, hips shot, back made of chalk, and hands that hurt. Where should I start?
You know, that's a great question. I also have a background in construction. I actually worked commercial HVAC contracting as a kid. I'm the son of a union contracting company in upstate New York. And
I knew we could be friends.
A huge part of the reason why I got into the profession that I'm in is I got to see the net result of that kind of work on bodies as they aged. I think probably the most important place for anybody who does a lot of really physical work for a living to start is actually going to be mobility. generally speaking, the process of repetitive motion injuries where you're using your body in kind of the same way over and over again and you're producing a lot of chronic pain, usually functionally that's going to be associated with muscles and joints shrinking and getting tighter. And as they shrink and get tighter, that's putting more and more pressure on the surface of the joint, and that pressure expresses itself as heat and then pain. So in a circumstance where repetitive motion injury is the thing that's really getting after you, starting with a program and a habit of consistent flexibility is going to be one of the most important things you can do to sort of mitigate against the negative impact of that repetitive motion.
All right. Well, first of all, I'm going to a little piece of advice for the future for you, Doc. When you're talking to a man in his 50s and later, don't use the word shrinkage at any point. Okay. Let's try to stay away from that. Because that's another guy. That's another person that's going to be a guest. So what can I do? Do a daily stretching, yoga?
Absolutely. The equivalent of yoga, it's really going to depend on what your specific issue is and where that injury is coming from, right? A big part of the process of knowing what you need to do in order to get it moving in the right direction is you have to know what's actually wrong. So if the problem is associated with muscles and joints are getting excessively tighter, depending on which part of the joint is problematic, you need to stretch it, right? If you're a person who sits at a computer for a living, usually your hip flexor muscles, your iliopsoas, are going to be way too tight, and having a habit of regularly stretching those is important. If you're a bricklayer and you're doing the same repetitive motion on your shoulder over and over again and the muscles of your rotator cuff are getting damaged, you're probably going to need some specific strength and flexibility exercises to help that, right? The nature of what we're providing at Chronic Care of Richmond is try to identify what that problem is. What is it that's adding fuel to the dysfunction, and then what is the strategy to get you going in the right direction?
Last week I was talking about my wife. My wife just had hip surgery. They had to bolt it, and then they put some spackling in there, and then they electrocuted the tumor. You know, that whole nonsense. And I was saying last week, and I think you can back me up on this. Physical therapy, when you walk into the room or even you're doing it, it looks stupid. It looks stupid and you feel stupid. And it's really, really helpful.
Absolutely. Yeah, it's funny. I just had this conversation with my best friend the other day. He was talking about how, why am I going to a place where a person is having me do exercises that I can comfortably do at home? It's the same reason why you call a professional to do anything. It's the knowledge of how the process works and what you need to do in order to do it appropriately. With physical therapy, with rehabilitative exercise instruction, the key is to understand why you're doing what you're doing so that you can make better decisions in the future about how to prevent the problem from being even worse. And, you know, the process of great rehabilitative exercise is going to include instruction on not just what to do, but why you're doing it, so you can really be cognizant of it and build a habit of sustained success. Most of the time, you're going to have homework, and if you understand why you need to do it consistently, you're going to get much better outcomes.
Oh, my wife's one of those people that does it. Yeah, she's one of those people, like, I have to work from home, and when I find her, she's working from home. I mean, she's one of those people. Now,
good for her.
But then you do have other people like, well, I'm gonna be selfish myself. They basically told me I don't need surgery yet, but chiropractic and injections. They're talking about injecting stuff into my spine, starting at my neck and ending somewhere about the belt line. What are you thinking of this?
It really depends on what those injections are and why they want to do it, right? Yeah, so cortisone as pain management is the gold standard, right? In terms of immediately stopping inflammation and damage in the tissue, cortisone is the gold standard. It is usually the first sort of act of trying to get pain under control and get swelling under control. There are downsides to cortisone injections, and there's definitely a reason that any provider won't give you multiple rounds of cortisone injections in a relatively short interval, right? The long-term consequences of the damage associated with the tissue with repetitive cortisone injections is often too high. It gets to a point the juice isn't worth the squeeze. At that point, you're stopping pain Usually for the first injection, it might help for 6 months. Then the second injection, it's only going to help for a month. Then the injection after that, now you got 2 weeks. And now the next step is surgery. And, pharmaceuticals and surgeries have their place in medicine. When people need that degree of intervention, as I said earlier, I'm not in the business of pounding a square peg into a round hole. If the nature of the damage is beyond what conservative management can help, sometimes you need a more invasive intervention. But if you don't need a more invasive intervention, the risks and potential negatives associated almost never outweigh the process of trying to encourage your body to be able to heal and repair itself. And the best long-term response is always going to be start with conservative management first.
Now, in the last 3 months, everybody on my Facebook page has become a nutritionist of some type.
For sure.
Did you know they put stuff in your food that's not good for you? I just found this out.
Yeah.
I was like, oh my, red dye is bad for me. Thank God for you, citizen. But no, I've been hearing the same nonsense, though, for years. I'm going to ask you. I've been told, well, Richard, what you need is turmeric, or what you need is amino acids, or you need ginger, or any of this stuff actually a real thing?
Absolutely. So
what?
Turmeric is
okay. I'm listening.
Turmeric's a great one. Turmeric, from a chemistry perspective, works remarkably similarly in terms of helping you to control pain in the same way that you take an aspirin, right? It's chemistry. It's all working on chemistry. The food that you put into your body provides chemical outcomes. And depending on what you put in for chemicals determines what your body is available to do. A huge percentage of the modern medicines that we're using have roots in nature and have roots in food. And the more you put real healthy food into your body and the more you avoid putting in those foods that are pouring gasoline on the fire of chronic pain, the more likely you are to have better long-term outcomes. A huge part of the reason that we incorporated a weight loss practice into Chronic Care of Richmond, and we are Weight Loss RVA, is because there is a very strong relationship between chronic pain and the foods that you're consuming on a regular basis. Think of it as a function of fuel. If you're running a diesel engine and you're pouring rocket fuel into it, the net result on that diesel engine is you're going to get mechanical failure. Parts are going to start to break down too fast. It's going to get too hot. There's going to be too much pressure. It's not wildly dissimilar in how our body functions. So what we're really trying to teach is how to understand the relationship between food and chronic pain and how to make better decisions about that, so you don't need the cortisone injections and you don't need the surgeries.
All right, Dr. Ben, look, we are out of time, and you were as great as I expected you to be.
Well, thank you for having me.
And that means you're going to actually have to come in here and be in studio at some point with me, if you don't mind that.
Yeah, that sounds great. Love to do it.
Excellent. Dr. Ben Hopsicker, Chronic Care of Richmond. Where do they find you guys?
Best case scenario is to give us a call at our office, or you can find us on the internet. We are Chronic Care of Richmond. We're here to serve our community.
Dr. Ben, thank you so much. I'm Richard McAnn, and this is The Home Show on News Radio WRVA.